Outside, let me thank Dr. Bakshi sir here, who's been a mentor for me for a very, very long time, for giving me an opportunity here, and of course Dr. Presented, who has been a mentor since I have been with ABCA, and all my friends here. Now, this is a topic I have been speaking for a long time. I have been dealing with many, many years now. I just wanted to share that autism is such an intriguing topic that every time I present, every time I talk about it, something new comes up and I learn something new. Not only that I deliver it to others also, but also I learn a lot of things. And today I will just show you how a simple remedy, we don't have to really go into hi-fi remedies and super class and such remedies and reptiles and animals. Yes, they can be important remedies for autism. Even ferns nowadays they say. But simple remedies, our ABC remedies within the 2025 constitutional remedies that we can practice, I am sure that can treat autism also. Second important thing that I want to deliver today is the evidence-based practice. So when we are dealing with a problem like autism, it's not only important that the symptomatology is reversed or the child becomes normal, but also it is seen on the psychometric and psychological tests also. So this is what we need to do on an international platform. We need to show as homeopaths that we have reversed the scores and the child has become normal. So let's start. It's a journey through solitude. One of the most important things of autism, you have to remember that a child is passing through a journey which is through solitude. An autistic child's biggest need is to be understood. As all of us know that it begins early in the childhood and eventually causes problems functioning in society, socially, school, work, for example. They show symptoms of autism in the first year, and therefore I always say that it is most important to catch these children early as possible. Some children show symptoms within the first year and then go through a period of regression between 18 to. This is very, very important because then we classify autism as a primary and secondary autism. Many children are born with symptoms of autism, many children are born normal, and at a particular time with some infection, some mental trauma, they can reverse, which is known as regression. And that's where homeopathy really plays a very, very important role, because we have ailments from loss of a pet, or death of a relative, or death of a pet, change of school, change of job, father going abroad. All these things can be taken as ailments from the child. Even a birth of a newborn. Another child when he is born, we have so many cases of autism where the second child is born and then the first child feels neglected and then starts showing symptoms of autism. While there is no cure for autism, intensive early treatment can make a big difference in the lives of children. Alarmingly increase in the number of ASDs, more than 60 lakh children are affected by abnormal conditions of the brain. 1 out of 500 Indian infants have some symptom of autism and 20,000 new cases are registered every year. Generally, it is more common in boys than girls, of course, because of the hyperactivity symptom of it. Now, till many years back, it was known that it is idiopathic. Till many years, it was known that it could be a genetic problem. But since COVID and since the COVID vaccine, we have seen that children were exposed to a lot of screen, gadget time, which constant visual and auditory stimulus are constantly working. The brain does not get any chance to shed off the weaker nerves. Here we come to the concept of pruning of the nerves. Remember, pruning of synapses. During the 6th or 7th month, whatever synapses are there in our brain, when we are in the womb of our mother, they are getting pruned, they are getting excess synapses are taken off. Due to some problem, these synapses they remain and therefore the child develops autism because of the multiple circuits, remember. Vaccination is yet another cause, but we can't blame vaccination completely because unless there is a predisposition to autism, the child will not be affected by vaccination. Infections, consanguineous marriages, mother's health during pregnancy. Recently in Spain, we presented a paper on role of abuse in mothers during pregnancy causing autism. We have at least 100 to 150 cases where we have shown that abuse during pregnancy, either it is a mental abuse, physical abuse, sexual abuse, this could lead during the 6th, 7th month, can lead to autism in the child or any other mental disorder, remember. This is very, very important. And that takes us to the concept of how our Indian, in our Indian society, how a girl goes to her mother's place in the 7th month, 6th month so that she is happy. She's being given all the food that is required, all the nutrition that is given. And if this is not given, the problem of autism can occur. Others are there, of course, rubella, lack and excess of oxygen. Again, oxygen lack is a big thing. So delivery, crying after delivery is very, very important, which should be asked in the history. So genetic predisposition plus environmental toxins can lead to autism. Now there are three things that you have to understand in autism. First is the behavioral issues: hyperactivity, temper tantrums, poor attention span, decreased concentration and poor focusing, which is the commonest thing the mothers will tell you. Secondly, there are speech, language and communication issues. And thirdly, social skill impairment such as poor eye contact. The mother is going to say that whenever I am talking to him, he looks somewhere else. He is not even asking, he is not looking at when I am calling him by his name. Poor interaction with peers. Now there are certain tests that we need to understand, though we may not directly do them, but we need to have a synchrony or a synergy with the psychologist or a psychology team. One of the most important tests that we have to do is a CAS. That is a Childhood Autism Rating Scale, which differentiates children from non-autistic to mild to moderate and severe autistic. Another test is ATIC, Autism Testing Evaluation Criteria. Another is VSMS, which is known as a Vineland Social Maturity Scale. And lastly, there are many Woodstock, Johnson, etc. There are a lot of other tests which psychologists can do, and of course we need them as evidence-based when our homeopathic medicine is given. So when we study the symptomatology of autism spectrum disorder, we see various patterns. Now, some children will come up with predominantly problems of behavior. They are known as kinetic, remember. So they will come up with a lot of hyperactivity, destructive, throwing things. Some children will come with intense sensory disturbances. They may be oversensitive to noise or touch. And the third variety of children will come with regressive pattern. We've seen children taking off their saliva, applying it on a table, even passing stools and eating their stools. So autism spectrum is, that's why it is known as a spectrum, because it goes from one end to another end. On one end you have got an intelligent, savant child, which is, you must have seen the movie My Name is Khan, in which Shah Rukh Khan had Asperger's syndrome. And so Asperger's syndrome is at the extreme right of the spectrum, where the children are very, very intelligent, though they are autistic. On the other hand, you see this mentally retarded, Down syndrome and all other criteria. So autism runs along the spectrum. You have to understand, right? Now you have to understand, in autism there is hypo and hyper functioning of the senses. So whether it is a touch sense, noise sense, or even hearing sense, or even any sense that we have, when it is hypo or hyper, that is the main pathogenesis of autism. Parents report that the child startles with sudden noises. Now we have a remedy like borax. Now remember, borax was also given as a constitutional remedy for autism, where the child has slightest noise and it gets aggravated, and fear of downward motion. So there is a proprioception problem as well as a sensory problem. This led to the diagnosis of borax. So borax is not only a remedy for aphthous ulcer, but it is also a remedy for autism, remember. So any remedy can be given for autism, remember. Okay? So borax, stramonium, acerem, palladium, carcinosin, nux vomica, opium, china, these are all the sensory problem remedies, remember. And these are the rubrics. So if you look at certain rubrics where caressed, aversion to be, or caressed, desire to be, cuddled to be. So some children would like to be cuddled, caressed. We have our phosphorus, we have our carcinosin, we have our pulsatilla who would like to caress. Now remember, these are the remedies that we have given. Pulsatilla has been given many a times for autism, remember. It's a very, very good remedy. At the same time, another child would have aversion to be cuddled. They don't like to be looked at, like Sina, Camomilla, antimony tart, antimony fruit. These are the remedies. So these are the rubrics that we commonly use in our practice. Remember. Noise inclination to make. So welcome Guru here. Now one of the important remedies in inclination noise to make is belladonna, and today we will talk about that remedy, how simple remedy can also take care of autism. Okay? So noise aversion to, startling noise from. Second character of the children is kinetic. So first pattern was sensory, the second is kinetic, where the children are very hyperactive, impulsive, and the remedies are tarantula, stramonium, tuberculinum, medoranum, nux vomica. At the same time, a destructive child can also be self-injurious, and one of the prime remedies for self-injurious children is lycinum. Remember, we use lycinum so many times for children who are very self-injurious. Third is the regressive pattern, as I have told you, where hyosamus, bufo, baraitaka can be used. These are the patterns that I have made, which can be useful for all of us. Now remember, these patterns will come mixed, but what is important is always we try to reduce the spectrum of remedies using this pattern. So we have got sensory pattern, regressive pattern, self-injurious, and kinetic pattern. This is one important thing that I wanted to, a very important concept of autism. 7 children, the very clever, intelligent children who are more intelligent than any of us, remember, with a good IQ. They have a tendency to play some good music, they have good retention skills, they can do anything, remember. So most common forms involve mathematical calculations, memory feats, artistic abilities, and musical abilities. This is the homeopathic case taking. It's slightly different from our case taking, where you have to give very important importance to the mother's history during pregnancy. Of course, the temperament of the child, major events at the time of regression, which is very important. Look at the sitting tolerance. Sleep position is yet another thing that we have seen in autistic children. Sleeping on the abdomen, sleeping in knee chest position always gives the clue to the remedy, remember that. Let's go to the case. This is the case of Mikhail. So he wants music all the time, and look at how he's jumping, again jumping on a pillow. Now you will have children who will jump just like that without even seeing. This child, you have to observe that he jumped from the bed onto the pillow, taking care of himself, right? So this is very important observation. Of course, this is a mild autism. This is not even moderate, severe. The child would be really jumping here and there. See how he climbs, climbing on the scooter. So climbing, jumping again. We can get many rubrics like this just looking at the children's video, remember. Also, this child is always singing. This was one more thing which we saw. Another thing was mimic, imitation, always acting like a teacher, wearing the specs and trying to copy his teacher. So a rubric called antics playing was taken, and of course imitation mimicry was taken. I am just trying to give you the rubrics immediately so that we don't waste time. See, he is singing all the time. Singing. This is again a 7th variety of autism. This child sings songs. He can retain songs very easily, and he can sing them very easily. So Mikhail Costa, 3 years, 9 months. Mother says that my pregnancy was good till 7th month, and in between 7th month, the baby moment I could not feel. I was admitted to the hospital after 2 days, got delivered because of the cord around the neck. So again there is an oxygen problem, again there is a trauma during pregnancy, remember. He was in the incubator for a week. About Mikhail, he has anger issue, gets angry if anything he is doing doesn't happen according to him, throws things in anger, bangs his head on running, jumping, climbing. He only listens by instruction when he wants, likes to play with cars, buses. Many of them are the symptoms of autism, remember. You have to find out the symptoms of autism and symptoms of the child. As Dr. Hanneman said, find out what is curable in the case and what is not curable. So you cannot take all the symptoms of autism, but if they are intense, you can take the symptoms, remember. Okay? Whole day he keeps singing. Likes dancing, shouting loudly. When we take him out for a party or any place, he only wants to run. Now this is the verbatim of the mother. Run means he is really running, remember. Okay? Doesn't sit in one place, doesn't eat anything. Very close to my brother and my dad. Loves to be in water, likes cakes, biscuits, rice, likes dancing. Looking in the mirror all the time, making different faces. If he sees the cats and dogs, he runs behind them to catch them. So there is no fear in him. Also makes faces, but not of animals. Current issue is speech, eye contact, doesn't sit in one place. So totality was banging in head, pulls my hair, throws things, eye contact is there with us, but strangers no. Does not sit in one place, sitting tolerance is not there. Many of these symptoms are common to autism, remember. So we have to take them out. Likes to play drums. Another thing was that when he was at a clinic, he was doing this all the time on my table. which I observed that it was a good thing that he had a tendency to make noise in one another. He was referred to psychodiagnostic assessment due to concerns. The psychologist said that an inconsistent eye movement, inadequate name recall, verbal communication and two-way interaction are below age, behavioral difficulties are there, social skills problem, and he was assessed. Total score was 32.5. I was talking about a CAR scale. And this is what we have to look at. We don't look at the symptoms only as homeopaths. Now remember, when we are talking of the case on a dais, where there are a lot of psychologists, psychiatrists around, we can't just talk about reversing the symptoms. We have to talk of the score also. So his score was 72.5, which states mild to moderate symptoms of autism spectrum. This was the repertoire in totality. Used one: playful, jumping, climbing, restless, pulls hair, throws things, antics plays, imitation, mimicry, noise inclined to make, striking head, smiling and singing. The remedy was very, very simple. Now remember, this is what I want to talk here, that remedies can be very, very simple. The remedy which covered all these rubrics was belladonna, and which has been one of my prime remedies for autism, with playful children, restless children, happy children. Not a regular picture of belladonna that we know, that irritable, pulling hair, rage and all those things. Belladonna is not like that. There are a lot of myths about belladonna, that belladonna is a very, very angry remedy. No, belladonna is a very, very nice remedy. Belladonna is a smiling remedy. It's a playful remedy, and you can indicate belladonna in many, many smiling, happy children. So first belladonna LM1 was given. After 15 days, speech, eye contact more. Sitting tolerance, head banging is better, jumping is also less. Speech with us, he keeps singing songs. Like any toy not working. Toilet he does not tell. Okay. Next follow-up, eye contact, we gave him LM2. Now LM potency is working very, very good in autism cases. I have seen it in my practice. So eye contact better, speech better, sitting tolerance is better, head banging 75% better, jumping is better. Can now tell about toilet. Now he has started getting toilet trained. This is a very, very positive sign. Okay. So belladonna LM2 was given. Again, better response, belladonna LM3, and is still taking the LM3. Okay. This was the psychology report done. Current progress as reported by mother: significant reduction in head banging, decrease in excessive jumping behavior, sitting tolerance is better, and speech. Now look at the old score and the new score after the remedy. So these are the changes. In particular, certain things it might be increased, in particular things it may be less. But look at the scores. It is coming from 32.5 to 25 now. So not only the child is feeling better, symptomatically is better, but also the CAR score has reduced, which is a very, very important thing.
चल अभी अपना स्कोर भी किया गया है।
हाँ हाँ हाँ।
तो मदर उससे बात की
हाँ।
रिद्धि से।
किससे?
रिद्धि जो बटरफ्लाई में है।
हाँ 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 हाँ। हाँ।
बात किया।
हाँ हाँ।
बोला कि ऐसा स्कोर भी कम हो गया है।
हाँ हाँ।
इसका प्रोग्रेस क्या है?
हाँ हाँ।
बहुत अच्छा है। स्कोर जल्दी कम नहीं होता किसी का।
हाँ हाँ।
इसमें हो गया है। हाँ मतलब इसे।
हाँ हाँ हाँ। ओके, और क्या बोल रही थी?
ठीक है बाकी। He said that he improving very fast, very good. अभी बहुत सारी चीजों में फर्क पड़ा है। कोई चीजों में अभी बाकी है।
करेक्ट। हाँ।
अभी तो रिस्पॉन्स अच्छा मिला है।
हाँ।
तो फर्स्ट टाइम रेमेडी से पहले रिस्पॉन्स आया भी है।
हाँ। या।
We should continue. तो
करेक्ट।
अभी वही करो तो पूरा था। अभी at present क्या कंसेंस है?
एट प्रेजेंट अभी सिर्फ वो मतलब हमारे साथ जो कॉन्वर्जेशन है, वन वर्ड कॉन्वर्जेशन करता है, जैसे फूड माम बोलता है फूड के लिए, और फिर मतलब वन वर्ड में वो सब बोल लेता है जो भी है, नो बोलता है, यस बोलता है, ऐसे आप बोलेगा, ऐसे डाउन बोलेगा, वो सब बोलता है, लेकिन फिर ज़्यादा कॉन्वर्जेशन नहीं करता है वन थिंग। एंड हाइपरनेस उसका तो बहुत कम ही है, लेकिन ऐसे अचानक दिन में कभी एक बार भी हुआ तो बहुत छूट होता है, नहीं तो होता ही नहीं है ऐसा। और जैसे हेड बैंगिंग करता था तो वो करता नहीं है, लेकिन ऐसे थोड़ा भी उसको कुछ मतलब कुछ नहीं भी हुआ है और उसने मुझे ऐसे देखा और ऐसे ऐसे कर रहा था ऐसे कर रहा था, और फिर वो कभी हंसता है तो आई थिंक इज डूइंग पर्पसली ऐसे। नाउ आल्सो आई एम टॉकिंग टू यू तो ही नोज आई एम टॉकिंग अबाउट हिम, ही सिट्स एंड ही लिसन्स एंड ही स्माइल्स। सी वो बैक कैमरा करके मैं आप
the psychologist.
I'm a practicing psychologist. It was truly an honor to work with Dr. Simmons on this case, where we met a 4-year-old child who was diagnosed with moderate autism. He had concern with the areas of social engagement, communication, sensory arousal, and as well as emotional regulation. So, Dr. Simmons saw this case as a holistic sense, and the child started receiving regular ABCA therapy from us. So, in a very short span of time, the child showed a lot of improvement in all of these areas, which was quantified on the basis of the CARS OST score. And at the same time, the clinical observation, and we received regular feedback from his mother that how she sees an improvement. So this is truly a sign that how homeopathy and psychology can work together to bring out the holistic improvement.
So these are the certain remedies that we have come across: carcinosin, belladonnas, lacasis, calendula, devotional metal, and glycines in my practice. Some of the rubrics we see: curious, precocity, contrary, noise inclination to make, restless children. But how is he restless? Jumping, climbing, running, love for animals, distress for animals, nature loves, traveling desire for, wandering desire for, cunning, deceitful, mischievous, hiding himself, destructiveness in children, throwing things. All these rubrics can be used in autism. Disobedience, defiant, dictatorial. So, main important thing here, what I wanted to tell you today was a simple remedy like belladonna can reverse autism. This is number 2. Second thing is have evidence-based practice, which is very, very important. Let the psychologists also talk about how homeopathy is helping. When somebody from the other side talks about homeopathy in a positive way, our practice is going to increase tenfold. Remember, it's very, very important. Get approval from a psychologist, a psychiatrist, make them homeopathy friendly. We are not foes, we are not enemies with them, neither they are our enemies. We have to work in integration. This is very, very important. This is what I wanted to